Okay.
And I'm looking at my phone, so I'll let you know if something pops up.
All right. So we are live. Good morning. I would love to share this video. So we are live. Good morning, everyone. We're live for Self-Care September, and we're going to have some good conversations this morning over coffee. And I would love for you to share this video if you're just hopping on. So we're talking about self-care, self-love today with Jackie Castro-Cooper, who is now a published author. And I'm going to be trying to share this video. If you can share this video, we would love it if you could, um, because so many people would benefit from this conversation. So let's see if we can share. All right. So I'm going to share from my phone. Okay. Here we go. So it has to happen from my phone. Good morning, everyone. All right, let's get started, Jackie, so that everyone here can. I tagged you and we can share it. And hopefully all the lovely people out there watching this can share it, because I know that your message is really powerful. And I think what better message than to go into a Monday, right? Uh, in the fall, at the end of September, with almost 90 days left in the year, right?
It's gone so quickly. And I'm so proud of you for doing live videos, because it's really important to connect with people during these times, because a lot of people are not connecting still physically with others. So it's really awesome that you're doing this.
Yeah, thank you. Yeah, yes. So the connection, I think people take for granted how much human, like physical contact and emotional connection is, like, really takes a toll on your health, like how much it contributes to how healthy you are, how fulfilled you are, mental health, like so many things, right?
Absolutely. Yeah. And that's why when I speak to you, Leanna, you always have a holistic aspect for your patients, for everyone that follows you. Whenever you speak, you always encompass that body, mind, and spirit. And that was one of the reasons why I had to jump into that as well, as a holistic alternative physical therapist. I had to write this book because we don't look at our body, mind, and spirit. We just look at one realm sometimes, but we don't really still to this day, I'm still getting patients that are thinking that it's just the body that is hurting, and it's not just the body.
Yeah, absolutely. So what I find too, I know you see this, that there are so many people who still have physical symptoms, medical conditions. They feel bad. They've got vague symptoms. They can't figure it out, but they're doing all the right things, right? So like you can be doing all. You can have like a pristine diet. You can exercise. Like you can be a race. Like a triathlon runner, right? Like a triathlon person. You could be an athlete, professional athlete, but like you can do all the things, but still feel bad and still run yourself into the ground.
Yes, because in the book, actually, it's called, my book is called The Power of Self-Care, Self-Love, a Physical Therapist's Guide to Evolving into Your Higher Self. And I use the proverb, you are a house with four rooms. And it talks specifically about what you just said. We have to, in order to have a balanced life, we have to open each room every day. The physical room, the intellectual room, the emotional room, and the spiritual room. And for me, that spells pies. So I remind everybody, all my patients and friends, I'm like, let's do pies every day because we all love pie. So being physical, moving just a little bit, I recommend for everybody to go outdoors. Intellectual, so just reading something or seeing something that's brand new sparks something new in your mind. Like last week, I did something that I've always wanted to do, which is make pottery. And I live in Biloxi, Mississippi, and this is like, the world of art and pottery and sculpture here, and I never go and do it. So for my brain, it was like opening up neurons. It's like, whoa, look at these sleeping, and it was hard as heck, but I loved it. So I did that for that day, and then the emotional, which is for me the journaling, right, or speaking to someone, a therapist or something, about emotions. And then also crying and screaming. That's the emotional room that no one wants to open up and go into. And then the spiritual room, it can be about religion, or it can be just about sitting quietly and meditating, just connecting to a force outside of ourselves, an energy system that many people call the field as well. Or scientists, actually, I put it in my book, Scientists, I quote Lynn McTaggart. She wrote a book called The Field, and in that book, she says, a lot of
Okay.
scientists and astronauts are calling the field, the electromagnetic field, actually the Holy Spirit. So that to me was fascinating, because my goal of my book is to connect science and spirituality.
Amazing. Amazing. Okay, so really quickly, so you have an acronym called PIES, and it's something short for people to remember that they have to practice every day. That basically is their self-care, like a self-care routine, right?
Yes, yes, yes,
So
absolutely. Mhm.
I love that. So PIES is, so say, let's say that one more time. So it's physical.
Physical, intellectual, emotional, and spiritual. And you could do it very quickly. It's just moving around, getting outside, and just walking for 5 or 10 minutes. There's a lot of evidence based data now, Dr. Liana, that says that if you just move for 5 minutes, it really is going to change your whole world, cardiovascularly, spiritually, emotionally. So 5 minutes, people are like, I got to go to the gym. And I'm like, yes, you can go to the gym, do whatever you love, but also remember that 5 minutes of something is also important. But also one paragraph of an inspirational book for the intellectual part. Emotionally, write one sentence in your journal, and then spiritually, just sit in meditation for 60 seconds, and boom, you are done. You've opened the whole 4 rooms, so it's not like a 45-minute ritual that I actually do. You could just do like 10 minutes and that's it. You're off and away.
Yeah. Yeah, I hear you. So yeah, that's one of the things I hear most from people. Like they don't have the time. So there's competing priorities, right? I mean, and I talk about this all the time to my people, to my clients. Like I know that they're competing priorities, and no one's stuff is more important than the other one, right? Like your things to do are important, my things to do are important. There's no one thing that we have to do that's more important than the other. It all needs to be done, but none of it can be done too, right, if we're not like able to carry it out, right? So if we're not physically or mentally in that space to actually do those things, right, to actually be able to go to work and show up at work and be productive, right, or show up for our kids or show up for family, the way that we really want to, that we mean to, right?
Exactly. And that was one of the main reasons why I wrote the book. My mother and my grandmother raised me, and I never saw them burn out. I,
Hmm.
I mean, these are two women that raised a family of five. We had no father. My mother was the main breadwinner, and the both of them, they never burnt out. They were always working all the time. But the key thing, I think, and I mentioned that in the book, when they were tired, they sat down. They said, that's enough. And they rested. They put their feet up. They would take a special herb if they had some kind of indigestion or something, they would take a certain herb. They would, in the book, I talk about my grandmother taking a tiny, tiny little shot of aguardiente, which is a Colombian liqueur. It's like
Like
moonshine,
a moonshine, yeah.
tiny little capful. I remember she would take it before she'd go to sleep, because I would remember she would say, "Oh, I'm just not feeling good. I'm not feeling good," and she'd take a tiny little shot and go to sleep. And the next morning, she was fine. So it's like these little antidotes that we've moved away from. Now we're more leaning towards only medication. Only things like whatever another person is telling us. We're not really focused on going within anymore. And I feel that that's why we need to go back to just slowing down and realizing, okay, this is too much. But most of the people that come and see me, they're pushing forward. They don't care. They could be having a little sign like, oh, I'm feeling like my chest is too heavy, but I'm still going to go to that meeting. I feel like I'm getting a little dizzy, but I'm still going to go and pick up those kids and take them to soccer practice. All that stuff. And it's like, wait a minute, we never used to do that. Our society, yes, when we became industrialized all over the world, we became disengaged from our body. But now there's no reason to do that because we're in a whole new wonderful world, a world of going within and becoming more aware of that inner wisdom that we're born with. I always say we have the ability to heal ourselves. And you were one of the very first persons, Dr. Liana, that said the doctor of the future is the patient.
Yeah.
And I love that because it's true. I tell everyone I meet, everyone that I see, you have the power to heal yourself. We here in the holistic alternative, and yes, a lot of traditional doctors do that as well. They remind you, you can heal yourself.
Yeah, that I love that phrase. That's actually something that my mentor taught me. The doctor of the future is the patient, and Sachin Patel, and he says that because he really truly believes that we have innate capability to diagnose ourselves and then figure out what's going on within ourselves and treat ourselves. So it's basically this premise that any sort of symptom is actually a message from your body. And if you have the awareness, or if you've kind of strengthened that muscle to figure out what those messages mean, then you could be able to figure out what it is your body needs to treat yourself, right? So along with having kind of a basic knowledge of what are the natural things we can do to help ourselves, there's also that intuition that comes along with it too. When you mix those two things together, then there's so many things that you could avoid taking or avoid having to do if you were just to tap into that power. And so yeah, so I love that. I love that. So, okay, so tell me a little bit about like the book and the way kind of how it's going to help people. Like who is the book kind of for? Like
It's
who
it's
who would
really
benefit?
it's really for everyone. I've had a lot of men, surprisingly enough, text me and message me and just say, "Hey, Jackie, this is a great book for men as well." And so that's why it's called The Power of Self-Care, Self-Love. It's not just for women, but I do want to say that women do carry sometimes a little more difficulties than men do. And a lot of men will agree with that. My husband will definitely agree that while we were raising our children, and even if you don't have children, you still, as a woman, I feel we are returning to a matriarchal society. And that's a good thing because having women guide us, right? Having women care for us and hold us and be there for us has just historically been the premise of probably the earth, of the existence of the world. Men are so incredibly important, right? But women are also incredibly important. So we're returning to that matriarchal. So the book focuses a lot on just for everyone to slow down and listen to their bodies. But it took 10 years to write this book because 5 years ago I had it done, and then I had it globally edited, and then the editor said, "Hey, that's a nice book," and she gave me the manuscript back, and I'm like, and then she goes, "But I really wouldn't buy it," and I was like, "What?" Why not? She goes, "Because you're not in it." She says,
Mm,
you've got great evidence-based research. You've got a great work cited, 5 pages of work cited work, so that's why it took 5 years to write it originally. And then she said, but you have to put yourself in it. You have to share your story, because then you're not going to connect with someone. If you want to help people, you have to share your personal information. And so in the book, it took another 5 years because I had to introduce myself and my mother and my grandmother. And that's really what has touched so many people is the stories of my grandmother and my mother and their powerful ability to move forward through really severe things that have happened to them. But those are the stories that people come back to me and say, hey, that story really resonated with me. And yeah, your mom was right, or your grandmother did this, and or you did this. And so it's a personal story mixed in with evidence-based research. And I talk a lot about, in one portion, the gut and brain connection, and which is what you and I have been talking about a lot in what we've created, the Women's Health Forum, right? But it's for everybody. So I talk about how when you're not feeling well, your gut is giving you messages. You're not pooping. That's a big message. When my grandmother couldn't poop, or some of us were ill when we were little,
Yeah.
she would say, hey, it's time for an enema.
Yeah. It's like a big deal.
We didn't think it was a bad thing. And she knew instinctively, when you're not pooping, it's going to affect you, globally as a whole person. But
Yeah.
we know, you and I know, that evidence-based research is pushing the gut and brain connection, which actually I'm almost finished with my online course, and that's what it's called. It's called Back and Neck Pain Relief: The Surprising Gut and Brain Connection.
Wow. That's fantastic. I love that. I
Because
love
so
that.
many people are having pain, but they don't realize it's because of their gut. There's something going on there, which is, not 80 to 90% of where our immune system is. It gives us messages of how to feel good, whether or not we're having anxiety and depression. A lot of people don't know that the reason that why they're having anxiety, right, is because they're not pooping.
Mm-hmm.
So,
Yeah.
so a lot of goodies in the book.
Yeah, yeah. So tell us, so if someone's having, because I know you're really an expert physical therapist, and you're not just like you're not doing the kind of traditional physical therapy. So tell us a little bit about that, about like how you practice.
So, so I have a master's in physical therapy, and I do practice a lot of what I've learned from the master's program. It was an excellent program, but I've just moved forward and added so many wonderful things from my own research and from my patients. Really, my patients have taught me so much. They come in and giving, like, one of the things I talk about is my patients like, yeah, my mom has drug-induced dementia. And I was like, this was about maybe 4 or 5 years ago. I was like, what the heck is that? It was like learning a new bad word in kindergarten, And I was like, well, what the heck is that? She's like, oh, it's because she's been taking all these medications for so many years, and she now has dementia. And I was like, holy Moses, wait a minute. I've been in the closet. So I call up a couple of my PT/OT friends, and they're like, yeah, I've never really heard of that. So I didn't feel so bad. So I did tons of research on it. So now, to answer your question, I focus on what medication they're taking, and then I ask them to have a conversation with their doctor.
Hmm.
That's really, really important, because doctors, as you know, because you are one of them, um, we need to be a family with our patients, with our clients. We really have to be able to surround them and uphold them, not be separate. So I ask them always, have a conversation with your doctor, or nurse practitioner, physician's assistant. Some of them see chiropractors, just say, hey, I'm taking this. Jackie mentioned that it could possibly be causing, high blood pressure, or it could be causing this and that. So that's one of the things that is really important. And interestingly enough, I was trained in this in physical therapy school. It's just that we don't have the time to practice everything. In physical therapy school, they told us to check the head to the toes in a sports bra and shorts.
Yeah, I love that yeah,
And
yeah.
we don't do that anymore. I remember my first job straight out of the master's a year after the master's program. And I was like, hey, I need that patient in shorts. And they were like, are you crazy? You can't do that. You're not even going to have the time. And I'm like, well, how can you see if they have red feet, or if they have no sensation? You're not taking their shoes off. Oh yeah, Jackie, you're just seeing them for their back. Focus only their back. And I'm like, No. It's
Yeah.
their whole body.
It's,
So we're trained in that. It's just that we don't have time to do that. And that's also for you as a doctor, before you jumped into this beautiful world of functional medicine and holistic alternative world that you're in, you only had a certain amount of time to see your patients as
yeah.
well. So
Well, I think that's across the board for a lot of healthcare practitioners. So, kind of no matter what field you're in, it kind of seems like that's something I see across the board with people is that in their training, they're taught to, practice a certain way or do certain things. And then once you kind of graduate and move on and enter the workforce, it's a totally different story as to how you continue that same exact practice that you were taught. So yeah, I absolutely completely 100% there with you on that. And that's actually, I think that's one of the things that a lot of, because I see a lot of healthcare workers and as clients, and that's one of the things I think leads to a lot, and I hate to call it burnout, but it's just this moral like dissonance, where you really want to help people and but you just in the infrastructure or the time that you're given, when you're actually practicing, it's not, it doesn't match up. It's not allowed. So you can't actually spend the time that you want to have or actually get, hear the story, right? Because, there's not, it doesn't allow for you to have this therapeutic relationship that we're kind of taught to have, right?
but we can change that. So in my book, I actually say, there's like 5 questions you could just quickly ask your doctor. One of them is, hey, doctor, can I get off of this medication in 3 months if I change my lifestyle? If I don't I don't cover food very much at all in my book, but for the people I treat, I always say, hey, what about decreasing your sugar little by little by little, maybe not eating so much dairy, because dairy causes inflammation in the gut. So I just kind of put little thoughts and then say, have a conversation with your healthcare practitioner about that. Some of my patients don't see doctors, they see holistic nutritionists, natural physicians. For me, I see a natural physician as well, and the doctors are there because they're there for you also. So you have a wide range of people that you can look at and ask for help, but always communicate with them because they're human also. And it's beautiful to have ask questions of your doctor. They want you to ask questions.
Yeah, absolutely. Absolutely. So, okay, so tell, sorry, we're so engrossed. This is such a good conversation. I had, I had a lot of questions
You want
for
me
you
to the way
regarding the
they
book.
Yeah, the way they can get the book is through Amazon.
Okay.
So
Yeah.
that's the easiest way. And it's also on Kindle, but it's also going to be in Spanish, hopefully in a couple of weeks.
That's amazing.
The translation has been extremely difficult. I didn't know how many ways that you can translate Spanish. I think there's like 50.
Oh yeah, the dialect is absolutely different.
So
So
there's 3 of us
so many
working
dialects.
diligently on it. So I'm really excited about that as well.
Oh, that's fantastic. So good. I'm so great. So people, so what I'll do is I'll drop a link to the book on Amazon. I have a Kindle version, so you can get a paperback, right? You get the physical copy.
Yeah.
You can get the Kindle version like I have.
Exactly. And the other thing is, I do have a newsletter that I do every month. And this newsletter has a video, a self treatment video that
Yes, I
I
know.
only share with my subscribers.
Yeah, I love your videos.
Thank you. And you can go to gcmfr.com. And that is, and you just put your first name and your email in there. So that would be awesome too, because it's just free and everyone can learn, how to self treat every single month. I also talk about books people can buy. So I share a lot of my information as well there. And then you'll get information there about my online course, Back and Neck Pain Relief, when it launches, hopefully at the end of fall or something, hopefully soon.
That's going to be exciting. So, kind of tell me a little bit about that. Just let's kind of go over that a little bit because I'm really interested in learning about that because I have online courses too, and I find that it provides really a wealth of extra knowledge for people because, right now with the amount of we're in the information age, and the amount of information on the internet, I think, is egregious. It's just you can find almost anything you want to find. And so people are tired of trying to figure out where to find a solution to their problem, number one. And also they don't they want a reliable person, right? They want, like, right now everyone's an expert, right? Everyone's an authority. But we want someone who is experienced. And so not only do you have the credentials and you practice what you preach, but you also have the experience of working with people. So tell us a little bit about that online course, because I think that's going to really benefit so many people.
Yes, thank you. So it's pretty much, I'm compiling in 21 videos, 15 years of what I've learned and what I
Wow.
treat with my patients. But I don't do like traditional, the physical therapy stuff. I do really almost everything that I do with my patients. And we do start off with meditation, right? Because in my book, I go through that, but meditation actually does decrease pain tremendously because it really focuses on thoughts. So I'm a big epigenetics person. So epigenetics means that your thought energy sends messages to your genes, right? So there's like a little bottle cap, right? If you think of a Coca-Cola bottle, there's a little bottle cap called IEGs, immediate early genes. And our thoughts within 3 seconds tells your genes how to respond. And so when your body says, "Oh, I'm calmer, I'm more peaceful, I feel happier, I feel more joyful, I feel in a place of stillness," your pain literally decreases. So I start off with just connecting people to these. I also do EFT, emotional freedom technique. So I teach people stuff
Wow.
that they're not going to get from other online courses because it's just the way that I have practiced for many, many years. So and they're all treatment techniques. So it's not like just me talking. It's literally, you're going to learn how to do every single thing step by step. So I'm really excited about that because a lot of people are suffering. They're still not going out to see their physical therapist. And, a lot of physical therapists are open right now. And a lot of people don't want to see them because we're still during this time, this difficult time. So I hope to be finished soon. It's just really difficult because I'm not a technological wizard. So I'm getting some people to help me.
Well, that's going to be fabulous. That sounds like it's going to be really, really good. So you're creating this course for people who have chronic pain, and they're going to actually be able to incorporate myofascial release techniques on themselves at home. So
Yeah.
that's
Yeah,
wow.
myofascial techniques. They're also going to be learning. I've created something called myofascial yoga. So I do a little bit of that as well. I incorporate a 2-hour workshop into like maybe 15 minutes. And then, so the videos are pretty short. There's only one video that's a little long and where I share something that I've created in terms of chakras. And I connect that with the neuroendocrine system. So I'm connecting chakra MFR, which I've created, with
Wow.
the neuroendocrine system. So neuro just means brain, and endocrine just means all these beautiful glands that create hormones and other magical things. So I just do this little connection so that people can understand the importance of these videos and how they can heal themselves and why.
Yeah. Yeah, because that knowledge behind the intention of trying to heal is really important.
Yeah, absolutely. We need to know the why so that way our body can understand more fully why it's healing.
Yeah.
So that's kind of cool to me. That's how I learn. And then people can just, they'll have it with them forever.
Mhm.
Once you get that online course, it's yours. And so you can continue doing this on a daily basis forever.
That's fantastic. Yeah, I think, last week I did a three-part series, a live Facebook in my group, and just for my group alone, because I wanted them to understand how important it is to, have a healthy mindset
Mhm.
and healthy emotions in order for you to have, optimized health. And so one of the things that I talk about was, being a harsh critic, right? Or actually having an unhealthy thoughts that that you can't heal, and analyzing those thoughts to see if they're self-limiting beliefs or not. And one of the points that I made was that every cell in your body is listening in on every thought you have. Like, they're not apart from each other. Like, every cell in your body hears the conversation going on in your head. And so when you're telling yourself that, you're suffering, you're in pain, and it's never going to end, and there's no end in sight, there's no healing, there's no cure, they get that message. And that's not the kind of message you want them to get. So I love that you brought up epigenetics, because it's exactly that, how your environment, regulates genetic expression. So
I love
exciting.
that you do that because no one talks about that. So yes, you are so spot on. It's actually a book that I talk about. It's called Power versus Force by Dr. David Hawkins. So what you're saying is, for me, it's the lower vibrational frequencies. I'm not good enough, or I'm too dumb, or I'm not smart enough. And that message goes to, we have 50 trillion cells in our body, and they all have 1.4 volts. So whether you, if you're saying that continuously, and it's okay to feel that, we're not saying don't feel bad. I'm not saying I feel happy 24 hours a day and I'm powerful and I can do it. It took me 10 years to write this book. Believe me, I had to overcome not good enough for a long time. So go ahead and feel that. Feel all those emotions. That's why the journaling and talking to people is so important. But it's the time spent hanging out there way too
Yes.
long.
Yes, I love that you said that, because a lot of the, like, self-help law of attraction type stuff that you see online is, it sometimes it can do some sort of what I call spiritual bypassing, right? Where you're actually not processing and like negative emotions or sad feelings or lower vibrational frequency emotions, right?
Mhm.
Because you're kind of getting the message that, if you're manifesting or a creator of your reality, you have to be in this high vibe state all the time. And so if you're feeling sad or if you're feeling angry, it's going to throw you off. And so people are just, I see a lot of people, and I've done this myself too. I've been through this journey where, you just try to always stay happy no matter how bad or sad something is. And you totally bypass feeling or processing that emotion, right? And that's when that emotion can kind of sit in your tissues, right? Like, your issues are in your tissues.
Oh my God.
And then, that's where we end up with a lot of pain sometimes, or issues, and, whatever, issues people are going through, whatever it is true for them. And so there's not, it's kind of like there's not this allowance, or like this, it's okay to feel sad or feel angry or have something make you just not feel good. But it's like you said, it's the time spent there. Like, you have to process something, like you have to process those bad feelings, right?
Mhm.
Those lower frequency emotions, in order for you to move through them, so that they're not subconsciously there, because that's the wrench that's hijacking you, right? So I love that. I love that you said that.
Yeah,
Um,
that's so beautiful for everyone. And in fact, Leanna, I will say that on the first day that I see anyone, doesn't matter where they're coming from, their age, and so on, I always say to them, the body, we somatically can sometimes hold on to painful times, trauma, for example. So I deal a lot with chronic pain. So the very first day, I do ask the tough questions. And these questions are, so if everyone feels that they're okay asking themselves, what traumatic experience have you been through? And if you don't want to tell me, that's okay. I tell them right off the bat, you don't have to tell
mhm.
me. I'm not a psychologist. I'm not a therapist. I am only here to show what I have learned through many years through my patients, that once they tell themselves or they tell me of the trauma that they've had, boom, that is when they begin to heal a little bit more and a little bit more and a little bit more, you know. So any type of abuse, verbal abuse, sexual abuse, you know, we're not just talking about a motor vehicle accident, we're talking about serious stuff here. You know, those can find a place within our bodies, right? Within our energy systems, and they can make a home there. And it's okay to make a home there for a certain amount of time, but we have to recognize that they don't belong there anymore. And that's when my patients begin to heal. And that's when everyone just says, oh my gosh, I've been harboring that for a very long time. And, you know, I'm not a trauma expert by any means, but Waking the Tiger is also very important. It's a wonderful book. I forgot the author right now, but you also talk a lot about that yourself. So what do you say about that?
Well, history of trauma, it doesn't have to necessarily be like sexual abuse or physical abuse, you know, not like the big scary things, right? Which are absolutely trauma. But you know, I think people you know kind of group the you know trauma, right? It's being talked about so much now, which is great, but people group them with like the big scary things, right? But it can also be something low lying, like you know, for me, I went through a really traumatic experience with one of my jobs after I completed residency, where I had this chronic like mental emotional like abuse from a supervisor, like chronically. And it wasn't like anything big or bad, you know, where it, you know, I was sexually abused or physically abused at work, but it was like this battering of my confidence from someone every single day that was really traumatic for me. And you know, so trauma comes in so many different forms. And yeah, and you know, it's just really important for us to recognize that, you know, when something is traumatic. So that's one thing that's really important that I try to tell people, is that you know something can be traumatic without having been this really big thing, you know, like there's and the thing is that we're kind of taught that, I think, in the mainstream, that like it's has to have this big label, you know, or this big scary label assigned to it. But trauma can be, there's so many different levels and layers to it. And you know, it doesn't mean that um you know, it doesn't mean that you didn't have trauma if you weren't like, you know, suffered some big abuse situation, you know.
Yeah.
And I had to realize that for myself, where you know that all of that, those years of like low lying kind of smoldering trauma that I went through was actually building up in my own body. And you know, I figured out years after that was over that that was still an issue for me. And then when I started to process all that, I realized like how traumatic that really was, and how far it took me from where I was before it to like, you know, when I realized it.
Yeah.
So I think just like you, when I see clients, it's on the intake form. Like it's just, we talk about it, and you know, I don't force people to go into it, but it's something good that people need to know. Like if you're working with a healthcare provider, right?
Mhm.
That, because that's actually something that can keep you from healing, right?
Absolutely. And I'm so grateful you brought up your personal experience, because you're absolutely right. It doesn't have to be a tremendous thing. It could be just, you know, like you said, an experience that you had during that time that really affected everything afterwards. So it's just important just to, you know, talk. Therapy is really so valuable, you know, going to see a therapist, or if you can't, just talk to someone, you know.
Yeah.
Yeah, definitely very important. And thank you for sharing that.
Yeah, my pleasure. So, all right. So, I think we're coming up on 40 minutes. So, I'm going to go ahead and hop off. So, tell people again where they can get your book. I have the Kindle version.
Yay. So you can go to Amazon and order it online. And it will be in Spanish, hopefully at the end of this month. And then definitely go to my newsletter, though. So it's gcmfr.com. And Dr. Liana, I guess you'll put that on
It's
the
already
bottom.
out there.
Yeah, thank you. And so just put your first name and your email address. And then when my online course launches, I will put that out there as well. I'm very excited about helping
Yes.
people. So you and I are when I first met you years ago at you were publicly speaking on meditation, yoga, and myofascial release. I remember you were talking about meditation. You were the only doctor that I could find that, well, there was one more, but he was out of town, and that you stepped up and said, you know, I'll talk about meditation. And I really wanted to thank you for that, because that was a pivotal point for me to get support from
Oh,
a medical practitioner. That's very, very important. And, you know, so yoga, meditation, myofascial release, moving your body. I talk about that in the book, but yes, I truly agree. In the future, and now is the future, you can heal yourself. So everyone that watches all of your videos, they need to remind themselves of that, and you empower them. So I'm going to post this on my Facebook as well. So how can people reach you, Dr. Liana?
well, this is being live streamed on all of my pages, so they know, they can always message me. Facebook Messenger is a way that lots of people get a hold of me, and or just commenting on this video. So yeah, and I'm so grateful to you as well, because that talk that you said that that I did was actually that was my, I kind of consider it my like coming out talk.
Yeah, it's
I
scary,
was
isn't it?
I
Scary.
was very conventional, and you know, in my medical practice, and that I had actually just come back from like a week-long meditation retreat with Dr. Joe Dispenza. And
Oh,
so
well,
I that's why I, you know, I just really had no fear about kind of like said, well, I'm just gonna kind of do this thing. And so you gave me that opportunity to speak in front of like 200 people. And I was kind of, you know, I didn't really think much of it until I saw the people, and I was like, oh, I'm really doing this. and that and that was my first time ever speaking publicly and speaking live about something like epigenetics. And so thank you for giving me that opportunity, because honestly, without that opportunity, I probably wouldn't be doing what I'm doing now. So I
thank
appreciate you.
you. Thank you. It's all about sharing, everyone. It's just about sharing information and being loving and kind. So that's my big thing. Just love yourself, care for yourself. It's, and I always use this metaphor. If you're not filling up this cup, you can't give anybody. You've got to fill your own cup. I know it's a cliche metaphor, but it's so true. If
So
you're not
true.
filling yourself up with care and love for yourself, it's very, very difficult to share it with others, you know.
Yeah, I totally agree with that. It's so subtle, and it sounds cliche at this point to say because it's said so much, but it's a hard truth. It's a hard reality. And, you know, I think that people take it for granted until they realize that the cup is really bone dry and really empty, and they're forced to fill it up. You know, unfortunately, I hate for people to have to get to that point, but you're right. That's absolutely true.
So hopefully everyone's going to share this video though, because we did share a lot of really important information. So even if people can't come and see us personally, please share this video, because you're going to
Yes.
be helping so many people right now. There are so many people that are suffering. They're very lonely. So loneliness is something that we need to address during this time as well. So please, everybody, share this video and help someone else.
Absolutely. All right, Jackie. So I'm sending you so much love. Thank you so much.
Thank you.
All right.
I love to everybody. Bye bye.
Bye.